네, 여러분 안녕하십니까? 저는 오늘 진행을 맡은 국제교류 담당관 김윤하입니다. 오늘의 서울 이스라엘 코로나 백신 접종 온라인 컨퍼런스는 서울과 이스라엘의 전문가분들을 모시고 안전한 백신 접종의 방향을 모색하는 시간이 될 것입니다. 본격적인 회의를 진행하기에 앞서 오늘 회의에 참여해 주신 국내의 패널들을 소개하겠습니다. 먼저 서울시 패널을 소개하겠습니다. 서정엽 서울시장 권한대행님 참석해 주셨습니다. 그리고 이재갑 한림대 감염내과 교수님 참석해 주셨습니다. 김창보 서울시 공공의료보건재단 대표님 참석해 주셨습니다. 그리고 박유미 서울시 시민건강국장님 참석해 주셨습니다. 최경주 서울시 국제협력관님 참석해 주셨습니다. 다음으로 이스라엘 측 참석자는 아키바 토르 주한 이스라엘 대사님이 소개해 주시겠습니다.
I'm Akiva Tor. I'm the Israel ambassador here in Korea. We are very, very excited to carry on this online conference with the Seoul municipality. I hope it will be the beginning of a very deep friendship and professional cooperation between us. I would like also to thank my colleague here, Hanan Soroya, our counsel, who did all the organization on our side. We have here two fascinating Israelis today. We have our Deputy Minister of Health, who, until he entered his political career, he spent almost 16 years as a fighter pilot, in which his major job was to fly straight and shoot down targets. And right now, his job, I believe, is shooting down COVID. So thank you very much. Deputy Minister, we're very, very happy to have you here. Our expert is Professor Ron Balitzer, who is the Chief Innovation Officer of one of the four Israeli HMOs, Clalit. He's also the chairperson of the National Experts Advisory Team, advising the Israel government on how to battle COVID-19. Gentlemen, thank you very, very much for joining us, and we look forward to this focused conversation. 감사합니다.
네, 반갑습니다.
네, 본격적인 회의에 앞서 서정엽 서울시장 권한대행님의 인사 말씀이 있겠습니다.
Shalom, I'm 정협 Seo, the acting mayor of Seoul. First of all, allow me to say how meaningful it is to be able to hear from Israel, a world leader in COVID-19 vaccination, about its experiences and know-how. I would like to thank Deputy Minister Yoav Kish and Dr. Randy Baliker for taking time out of your busy schedules to accept our request for a video conference. I would also like to thank Ambassador Akiva Toru and the embassy staff for helping us arrange this meaningful occasion as well. As of February 26, the Seoul Metropolitan Government embarked on a long journey of vaccinating our 10 million citizens. We began vaccinating high-risk groups first, which are usually old-age patients in nursing homes and nursing facilities. Our goal is to vaccinate 70% of our 10 million citizens, which is approximately 6.06 million people, by the end of October this year. Our citizens are eager to return to their normal lives with the vaccinations. Yet at the same time, they are concerned and even fearful of going down an unknown path, especially with the newly developed vaccine. I believe that Israel's experience of vaccinating more than half of its population will provide much insight to us, just as we begin our vaccination program. I heard in the news that since Israel began its vaccination program, the number of newly confirmed cases have dropped by 1/3 compared to that of the middle of January. I also heard that for those who have received 2 doses of the vaccine, a so-called green pass is issued and entry into various facilities is allowed. This is truly uplifting to hear and will indeed be helpful in reassuring our citizens who may be feeling a bit anxious and nervous about being vaccinated. The Seoul Metropolitan Government hopes to learn more about Israel's operation and post-management of its vaccination program through this video conference. We hope to receive realistic and practical advice, and we hope to have candid and in-depth discussions and debate as well. I kindly ask for your frank opinions and suggestions today, and if you have any questions about Seoul's countermeasures against the spread of the pandemic or our policies regarding vaccination, please feel free to ask. I'm confident that everything that we will hear from you today and discuss with you today will be an important driving force in our journey of vaccinating our 10 million citizens. The global community is realizing all the more so since the outbreak of the pandemic that we really are one, and that solidarity and cooperation really are the key to overcoming this worldwide crisis. I look forward to today's video conference, moving forward the timeline for returning to normalcy, not only for Israel, but also for Seoul. I also look forward to it being a venue for solidarity and cooperation that helps open up the long closed borders of the countries around the world as well. Thank you very much.
네, 다음으로 요아브 퀴시 이스라엘 보건부 차관님의 인사 말씀이 있겠습니다.
Yes, I got my name even though it wasn't my native language that I'm used to. So again, good morning from Israel, good afternoon to you in Seoul. Dear speakers and guests, thank you very much for inviting me. I will share our experiences both on the vaccination program and results, and I think what we call the Green Pass is something that is the future that the vaccination can get us all to, and I'll talk about it also a bit more. Following me is Professor Balitzer, who is an expert and a doctor, and he will give you, I guess, more actual data.
네, 오늘 회의 첫 순서는 이스라엘 백신 접종 사례에 대한 발표가 준비되어 있습니다. 코로나 백신 접종 현황과 백신의 효과, 초기 접종률 제고 방안 등에 대한 발표입니다. 클라릿 공공의료 서비스 최고 혁신 책임자이신 랜디 발르커 교수님, 발표 부탁드립니다.
Thank you kindly. It is both a pleasure and a privilege for me to be speaking with you today. And with your permission, I will now share our slides in order to present the topic of vaccination as a key measure for tackling the COVID-19 event. And now for this presentation, my name is Ran Balisser. I'm a physician and a scientist, and I'm the director of the Clalit Research Institute and Chief Innovation Officer for Clalit, Israel's largest healthcare organization, and chairman of the National Experts Advisory Panel on COVID-19 response to the Israeli government. So in Israel, there's universal healthcare, and every citizen is entitled for a wide variety of health services provided by one of four organizations, that Clalit is the largest one of them all, and responsible for the care of over half of the Israeli population through community clinics, hospitals, and many ancillary services. So this is what COVID-19 looked like in Israel until now. You can see here the three main waves of infection that we have gone through in the last year. And you can see here the first wave in March, the second wave around September, and the current wave that we are now at the last phases of, the third wave of 2021. What I would like to share with you is something about how we use data in order to tackle COVID-19. So in the earlier phases and the earlier waves, one thing that we have done in Israel is to use prediction and predictive models and artificial intelligence in order to identify the patients at risk. And we did this at the Clalit Research Institute. And by identifying the population at risk, we could approach them and tell them, be careful. Do not leave home and to come to the clinics. We will come to you. And we used a lot of telemedicine and a lot of specialized services in order to make sure that the people are protected. And so what you can see here on the right-hand side is the case fatality rate. And you can see here a comparison of many different countries. And you can see the case fatality rates in all of the countries. And in the bottom is the case fatality rates in Israel, the percent of people who died from those that were infected. And one of the reasons it is so low in Israel, beyond our age structure, is our ability to keep those people at risk safer and out of harm's way, as well as the care that was provided in the hospitals. Now, what I would like to focus now on the vaccination and its impact. So vaccination came in the third wave. And in the third wave, what we saw was two contradicting effects on severe illness. On one hand, we have seen the B117, the UK Kent variant, becoming the prominent, dominating variant during the months of late December, January, and February. By now, it is 90% and more of all new cases. So that has increased dramatically infection rates and has increased the number of severe cases. In parallel, we had our vaccination campaign that has reduced the infection and reduced severe illness. And what we see is the combination of two in the impact. So our vaccination campaign was very quick. We've been able to vaccinate 55% of our population within a matter of 2 months. And that is a good achievement that we are quite happy with. And if you will look at the data, you will be able to see that we've provided over 8 million doses in these 2.5 months to almost 5 million different people, which is, as we said, 55%. And by now, 3.2 million individuals are fully protected. They got 2 doses of the Pfizer-BioNTech vaccine and 1 week have elapsed afterwards. And so it is important to say that we focused our vaccination campaign on the elderly. We started with the 60 years and older, and we moved to the 50 years and older, and only then we opened to the rest of the population. And so by now, over 80% of those above the age of 50 are fully protected by 2 doses of the vaccine. How did we do it? How did we get so many people vaccinated so quickly? There is a set of reasons how it happened. First of all, it is almost not fair to compare our vaccination campaign with that of other bigger countries because Israel is younger and smaller and geographically condensed. So that helped us in our distribution change in our logistics. So vaccines come in to the airport through the airplanes, but they go from there from centralized government distribution centers where all the big freezers are at. And from there, they go directly to the vaccination clinics that were operated by the HMOs, by the sick funds like Clalit. Most of the vaccines in Israel were provided by Clalit, by the big sick funds. And because we are used to providing outreach driven care to our population in the community through the HMOs, it was easier for these HMOs to open dedicated vaccination clinics, every vaccination clinics with dozens of vaccination booths and people, vaccinators in every such booth and one physician for the entire compound and several administrators, and that was very effective. We have a lot of digital health in place, so everything was completely digitized. The scheduling of the appointment is through the application, and the rescheduling of the second appointment is through the application. And when people who couldn't use the app, we had low-tech scheduling done by dedicated call centers that called the elderly and made sure they come in. We made our vaccination campaign very simple by targeting the elderly first, 60 years and older, and healthcare professionals. And only when we exhausted that group, we moved to the 50 years and older, 40 years and older, and until we opened for everyone. It's also important that we had a lot of agility in our operational, and so by the end of the day, when it was clear that we should vaccinate people and there's not enough people coming in, we said we open to everyone, regardless of age. And you know, nurses went outside and just brought people in and gave them vaccination to make sure that we don't throw away any vaccines. And so that was very important. Finally, it was important to work with community leaders to persuade them that the vaccine is safe and effective, which we did. I myself participated in rabbinical classes of ultra-Orthodox leaders, persuading them, that showing them and explaining that the vaccine is safe and effective, and they have given afterwards a rabbinical verdict that says, go ahead and get vaccinated, and that helped their communities to believe this and get vaccinated. Now, very quickly to talk about how well do the vaccines work. Because we have all of the data and because we have strong research institute, we have been able to do these calculations. So as you know, the clinical trial by Pfizer has showed that the vaccine is 95% effective in preventing symptomatic illness. What we have tried to do is to emulate this in our own study, and our study that was published in the New England Journal of Medicine last week, you can see it here on the screen, has been able to demonstrate a 94% reduction in symptomatic infections in the real world, which is quite surprising because in the real world, the cold chain is not as well maintained and the population is more diverse and there's more elderly and there's more people with background illnesses, but still we've been able to show 94% reduction in symptomatic infections. And we did this by creating perfectly identified groups of vaccinated and unvaccinated. We had 600,000 vaccinated and 600,000 unvaccinated people compared, and they were completely identical. The unvaccinated, if an unvaccinated was a 56-year-old male from a neighborhood in Tel Aviv with 3 comorbidities and last year getting flu vaccine, the comparator to him individually matched was a different 56-year-old male from the same neighborhood that was not vaccinated and had the same number of comorbidities. So it was a one-to-one comparison, and we followed them up. And then we could also say, for instance, that we know that the vaccine is also 92% effective in reducing severe illness. So this was quite critical and quite interesting. And we now know that the vaccine is very effective. And the outcome of this, and this is my last slide, is that we begin to see a drop in the severe illness, hospitalization for severe illness, that started with the 60 years and over, because that's the group that was vaccinated first in the red graph. And then, only then, in the 0 to 59-year-old group, we can now see the decline, but it started later because they were vaccinated later. So I will now be happy to entertain any question, and thank you very much for the opportunity to speak with you, esteemed colleagues, in this morning. Thank you so much.
네, 발리커 교수님 감사합니다. 다음으로 최경주 서울시 국제협력관이 준비한 서울시의 코로나 방역 및 백신 접종 계획에 대한 발표입니다. 국제협력관님 시작해 주십시오.
예, 서울시 국제협력관 최경주입니다. 인상 깊은 설명 잘 들었고요. 저는 서울의 코로나19 방역 대응의 주된 내용과 그리고 백신 접종의 대책에 대해서 말씀드리도록 하겠습니다. 우선 대한민국의 방역 체계에 대해서 간단히 설명을 드리겠습니다. 한국 정부는 코로나19 대응을 위해 국무총리를 본부장으로 하는 중앙재난안전대책본부를 가동하고 있습니다. 그리고 중앙방역대책본부가 방역 컨트롤타워 역할을 수행하고 있고요. 그리고 보건복지부가 중앙방역대책본부의 방역 업무를 지원하고 있습니다. 각 지방자치단체에서도 단체장을 중심으로 해서 지역 재난안전대책본부를 구성하여 방역 현장 업무를 총괄하고 있습니다. 사회적 거리두기라든가 진단검사, 역학조사, 그리고 병상 확보 등 방역 현장 전반의 업무가 지방정부에서 이루어지고 있습니다. 매일 아침 국무총리 주재하에 중앙정부 관계 장관들과 지방정부 단체장들이 화상회의를 통해 상황을 점검하고 지원 및 협조 사항을 논의하고 있습니다. 중앙과 지방의 관계는 자율적이면서도 보완적인 역할을 수행하고 있는데요. 예산, 법령, 인력 등을 중앙정부에서 지원하고 조정을 하는 반면에 지방정부의 선제적 그리고 실험적 대책들이 전국적인 대책으로 확산되는 경우도 많습니다. 다음 코로나 현황입니다. 서울의 경우 지난해 1월 24일 첫 확진자 발생 이후 올 3월 3일 기준으로 총 28,573명의 환자가 발생했고요. 전국적으로는 98,816명이 발생했습니다. 그리고 사망자는 서울이 385명, 전국은 1,612명입니다. 참고로 서울의 인구는 약 1,000만 명이고요. 한국의 인구는 약 5,160만 명입니다. 서울의 코로나 방역 시스템에 대해서 설명드리도록 하겠습니다. 크게 검사 확진, 그리고 역학 추적, 격리 치료라는 3T 체계로 요약할 수 있는데요. 이 외에 사회적 거리두기, 시민 소통, 재난 지원 등도 방역에 중요한 역할을 하고 있는 분야가 되겠습니다. 첫 번째 이제 테스트에 대해서 설명을 드리면요. 서울시는 유전자 증폭 기반 대량 진단 검사 실시를 통해 다량의 검사를 신속하게 진행하고 했고요. 개인 정보에 민감한 시민들을 위해서 익명 검사를 도입했고 무료 선제 검사를 실시해서 증상이 없더라도 서울 시민이면 누구나 무료 검사를 받을 수 있도록 해서 무증상 전파를 사전에 차단하였습니다. 그리고 신속하고 빠른 검사를 위해 25개 자치구 보건소와 주요 교통 지점에 검사소를 설치했습니다. 워크스루, 드라이브스루 등 다양한 방식의 공공검사소를 도입했고요. 아울러 요양원이나 산업 현장 등 검사소를 찾기 어려운 시민들을 위해서는 찾아가는 검사소를 운영하고 있습니다. 두 번째는 이제 추적인데요. 그 확진자의 구술에 기반한 1차 조사 후 GPS 의료 이용 정보, 카드 정보 조회 등 2차 심층 조사를 진행해서 확진자의 동선을 신속하게 파악하고 있습니다. 그리고 이동 동선에 따라서 현장 CCTV를 확인해 접촉자 범위를 한정했고요. 시민들에게는 SNS 및 문자 서비스를 이용해서 확진자 동선 등 실시간으로 투명하게 코로나19 관련 정보를 제공했습니다. 특히 자가 진단 앱이라든가 격리 앱 등을 통해서 코로나 의심 환자를 관리하고 있습니다. 마지막으로 이제 치료인데요. 확진 환자의 심각성 정도에 따라 중증 환자는 감염병 전담병원으로, 경미하거나 무증상인 환자들은 생활치료센터로 분리 운영해서 맞춤형 치료를 실시했습니다. 고령 확진자가 증가하면서 중증 환자 치료 체계를 구축했고요. 기저질환자나 고령자에게 특별 관리를 강화했습니다. 다음은 서울시의 백신 접종 계획에 대해서 말씀드리도록 하겠습니다. 서울시는 18세 이상 서울 시민의 70% 이상인 약 606만 명에 대해 10월 말까지 접종을 완료하는 것을 목표로 하고 있습니다. 이를 위해 3단계 접종 대상, 3개 트랙, 3중 관리라는 333 대책을 마련했고요. 먼저 백신 도입부터 유통과 공급, 접종까지의 체계를 설명드리도록 하겠습니다. 백신 도입은 질병청에서 총괄하고 있습니다. 유통과 공급 역시 질병청이 총괄하고 있고요. 국방부가 수송관리, 식약처가 유통기준 수립, 국토부가 항공수송, 관세청과 조달청이 각각 통관과 조달을 담당하고 있습니다. 예방접종 단계에서는 복지부와 국방부가 인력관리, 경찰청과 소방청이 보안과 구급을 담당하고 있고요. 서울시는 접종센터 운영과 홍보, 그리고 이상 반응 관리 등 백신 접종의 실제적 이행을 맡고 있습니다. 그러면 서울시의 대책을 구체적으로 설명을 드리도록 하겠습니다. 우선순위에 따른 접종 대상의 3단계 구분입니다. 중증 혹은 사망 위험도, 의료, 방역, 사회 필수 기능, 그리고 지역사회 전파 위험도를 고려해가지고 우선순위를 정했는데요. 먼저 2월 26일부터 서울 시내 요양병원 137곳과 요양시설 277곳에 만 65세 미만 입원, 입소자, 종사자 등 24,621명에 대해 접종을 시작했습니다. 그리고 4월에서 6월 기간 사이에는 전체 대상자의 한 30.5%에 해당되는 185만 명에 대해서 접종을 시작하게 됩니다. 여기에는 이제 65세 이상 노인, 그리고 노인 재활 복지시설 이용자와 종사자, 그리고 장애인 및 노숙인 시설의 입소자와 종사자 등이 대상이 되겠습니다. 그리고 7월에서 10월에는 전체 대상자의 약 67.8%인 411만 명을 대상으로 접종을 하게 되고요. 여기에는 이제 50세부터 64세 성인, 그리고 만성 질환자, 군인, 경찰 등 기타 시민 순으로 순차적으로 접종 대상을 정해서 확대할 계획입니다. 다음 계획은 접종 방법에 관한 사항인데요. 우리 시는 백신의 특성과 도입 시기, 그리고 접종 대상자의 상황을 종합적으로 고려해서 예방접종센터, 위탁 의료기관, 방문 접종이라는 3개 트랙으로 백신 접종을 추진할 계획입니다. 우선 예방접종센터에선 초조원 관리가 필요한 화이자, 모더나 백신 접종이 이루어지고요. 정부가 중앙접종센터 한 곳을 국립중앙의료원 내에 설치했고요. 서울시가 지역접종센터 29개소를 구민회관, 체육관 등 대규모 공공시설에 설치 운영하게 됩니다. 25개 자치구마다 한 개의 지역 종합 접종센터를 설치하고 인구가 50만 이상인 4개구에는 1개소씩 더 추가 설치할 계획이고요. 다음은 시민들이 거주지에서 가까운 병원에서 백신 접종을 할 수 있도록 위탁 의료기관을 확보하는 것인데요. 이미 1월 말 수요조사를 통해서 3,151개 의료기관에 참여 의향을 확인했습니다. 6월까지는 위탁 의료기관 3,500개소를 확보할 계획입니다. 그리고 마지막으로 찾아가는 접종은 노인, 중증장애인 등 방문 접종이 어려운 시민들을 위한 서비스인데요. 25개 자치구에서 의사 74명, 간호사 173명, 행정인력 170명을 배치해서 총 41개 방문 접종팀을 운영하고 있습니다. 그리고 마지막은 이제 3중 관리가 되겠습니다. 서울시는 시민들께 안심하고 접종할 수 있도록 예진, 모니터링, 응급 조치 등 3중으로 관리 대책을 실시하고 있습니다. 우선 백신 접종 전 예진 단계에서 알레르기 반응과 관련한 아나팔락시스 위험군을 사전에 선별하고요. 접종 후에는 현장에서 한 15-30분간 이상 반응이 발생하는지 관찰 모니터링합니다. 기가 후 이상 반응이 나타나는 경우를 대비해서 신고를 통해 응급 조치가 이루어질 수 있도록 병원과 연계하고 있습니다. 특히 민간 합동 신속 대응팀을 운영해 중증 이상의 위급 상황이 발생할 경우를 대비하고 있고요. 이상 반응 소통을 위한 시구 질병관리청 간의 핫라인도 운영 중입니다. 마지막으로 홍보 대응과 대시민 캠페인에 대해 말씀드리도록 하겠습니다. 백신 접종이 시작되고 시민들의 관심과 우려가 동시에 높아지면서 서울시는 시민들을 대상으로 백신 도입과 공급 그리고 접종에 관한 정보를 신속하게 제공하고 있습니다. 서울시 홈페이지 내 백신 전담 페이지를 만들어서 백신에 관한 일반 정보와 접종 계획에 대해 공지하고 있고요. 접종 관련 신고 문의 제한 접수 창구를 운영하고 있습니다. 또한 서울시의 민원 서비스 창구인 120 다산콜 상담센터에서 코로나 예방 접종 일반 상담센터를 운영하기 시작했고요. 답변의 전문성을 높이기 위해 전문 간호사를 배치했습니다. 5월 이후에는 간호사 등의 의료 인력을 추가 투입해 즉답이 어려운 전문적인 내용을 시민에게 다시 전화해서 답변하는 콜백 서비스도 실시할 계획입니다. 그리고 백신 접종을 시작으로 일상으로의 복귀를 위한 첫발을 떼었다고 생각합니다. 반면 백신 접종에 따른 이완된 경각심이 확진자 급증으로 이어질 수 있다는 우려가 큰데요. 당초 목표한 백신 접종 수준에 달할 때까지 시민들의 적극적인 참여를 통해 마스크 쓰기, 사적 모임 금지 등 사회적 거리 두기를 지속해 나갈 계획입니다. 지금까지 서울의 코로나 방역 대응과 백신 접종 대책을 간략하게 설명을 드렸습니다. 오늘 화상회의를 통해 이스라엘과 서울의 노하우를 공유하고 시민들에게 보다 나은 정보와 정책을 제공할 수 있기를 기대합니다. 경청해 주셔서 감사합니다.
네, 최경주 국제협력관님 수고하셨습니다. 네, 다음으로 백신 접종에 대한 자유 토론 시간을 가지도록 하겠습니다. 먼저 백신 접종 현황과 접종 원칙, 주요 성공 요인 등에 대한 이야기를 나눠보겠습니다. 서울시 측에서 질문하실 분 있으십니까?
예, 서울시장 권한대행입니다. 우리 랜디 발리코 교수님 프레젠테이션 잘 들었고요. 또 우리 최경주 국제협력관 프레젠테이션도 수고하셨습니다. 저는 그 관련해서 우리 몇 가지 좀 질문을 좀 드리고 싶은데요. 단답형으로 이렇게 좀 제가 질문 드리고 답변해 주시고 하는 식으로 진행하시면 좋을 것 같습니다. 이제 시민들의 입장에서 보면은 접종 초기에는 또 많은 시민들이 접종을 받기를 원하시기 때문에 접종률이 이렇게 빠르게 상승할 거로 생각이 되는데요. 근데 이제 점차 시간이 가면서 또 여러 가지 이유로 접종자 수가 준화될 수도 있다고 생각됩니다. 지금 이스라엘의 경험에 따르면은 지금 2달간 930만 명 중에서 500만 명, 그러니까 55%의 접종을 달성하셨는데 지금 전체적으로 2달간의 이 추이가 어떤지 간단히 좀 말씀해 주시면 좋겠습니다. 그러니까 전반적으로 뭐 꾸준하게 이렇게 접종이 되고 있는지 아니면 처음에 비해서 좀 속도의 변화가 있는지 답변 좀 부탁드리겠습니다.
Thank you very much for this question and for the wonderful presentation. There's so much we can learn from what you are doing. Regarding the question about the vaccination rate, we at the beginning had a quick escalation in the number of daily vaccinated people as we gained our experience and opened more and more vaccination clinics up until a point about a week and a half into the campaign of vaccinating as many as 250,000 people per day. And so for the first 3 weeks, we had very high vaccination rates. After 3 weeks, we had to combine giving first dose and second dose in the same clinics. So the numbers remained high, but we had a lower number of new vaccinated people. And after a few weeks more, we did see a decline in the uptake. And as the first most, I would say, enthusiastic people exhausted, and we had to go for the rest of the population, we had to have some more efforts put into encouragement and explanation and very open discussion with the public in order to enhance vaccination. And at some point, the vaccine uptake went down, at which point we have finished our big studies on the vaccine effectiveness. And when we released those information about the vaccine effectiveness in Israel, with the actual data that shows how effective the vaccine is and how good the protection is, we saw an increase, again, in the vaccination uptake, and now it is pretty constant. And we are trying to get the last bit of the elderly, several 100,000 people of the elderly that were not vaccinated. And as we get to the very last of them, it's becoming more and more difficult to bring them in. I will also mention that because of the work we've done in specific communities, ultra-Orthodox, Arab-speaking, etc., specific places demographically, every time we made specific work with the subpopulation, we saw an increase in the uptake in that subpopulation.
It's interesting to see that, because we have also here about the same amount of citizens. We're 9.3 million people here in Israel, out of which a bit less than 3 million are youngsters under the age of 16, which are not, of course, still are not approved for the vaccination. We gave in Israel until now only the Pfizer vaccine, and we are very successful in pushing forward almost to the maximum as possible for the vaccination of the 6 million people potential that we have in Israel. What we see in the current situation in the COVID is that we dropped from about something like average max of 8,000 new cases per day. This is a huge number, which was, of course, came together with high numbers of hospitalized cases and death, and it dropped. Mainly, we went through a closure, but the numbers also, mainly right now, since we opened the closure, are held because of the vaccination program. We are having reduced the severe cases in our hospitals from 1,200, we dropped to 750. And we have reduced the numbers, and that's the most amazing thing. Since we started by vaccinating people above 60, the most vulnerable to the disease, and we saw the graphs, the difference that went together through all the disease separating. Once we achieved the numbers and the time passed 1 week after the second shot of the vaccine, we saw that at that age, the 60 and above, were less and less in their percentage in the hospitals. And that's the amazing results of the vaccine. So one thing for sure, at least for the Pfizer, we have very good results. It's working, it's reducing, giving immunity for more than 95%. And what you also see that it's reducing the chances of getting even passing the disease. So, but I'm not gonna elaborate more on that. This will be done, I guess, by Professor Balitzer after.
예, 답변 감사드리고요. 두 번째 질문은 이제 조금 전에 우리 서울시 프레젠테이션에서 보셨지만은 뭐 여러 가지 이제 그룹들이 있고 이제 그룹별로 저희들이 백신 접종을 이제 시작하고 있습니다. 그래서 처음 시작은 이제 요양시설 또 요양병원으로부터 시작해서 또 병원 관계자들에서 쭉 하고 있는데요. 이스라엘에서도 이런 백신에 접종해서 우선 순위가 있었다면은 어떤 그룹들을 우선적으로 했었는지 답변 좀 부탁드리겠습니다.
Thank you. So the first priority group in Israel was elderly above the age of 60 and healthcare professionals and immediate caregivers of bedridden patients. This was the first priority group. After that, after we exhausted many of those, we opened for the 50 years and older, as well as school teachers. And when we exhausted that group, we went to 40 years and older. And the next group was everyone else. So this was a very simplified approach that we took for vaccination prioritization. It worked very well.
예, 감사합니다. 그리고 조금 전에 이제 프레젠테이션 하실 때 여러 가지 그 백시네이션 캠페인, 그 백신 접종 이런 여러 가지 활동하셨던 걸 했는데요. 뭐 너무 여러 가지를 보여주셨는데 그 중에서 정말 초기에 이제 백신 접종에 대해서 사람들이 이해도가 낮을 때 아까 뭐 에스컬레이션 쭉 되는 과정에서 좀 이렇게 굉장히 효과가 있었던 캠페인을 한두 가지 좀 말씀해 주시면 좋겠고요. 그다음에 이제 지금 이스라엘에서도 55% 넘어가면서 이제 남은 그룹들의 아까 조금 이제 과제라고 말씀을 하셨는데 그 그룹들을 위해서는 그 그룹들이 접종을 받게 하기 위해서는 또 어떤 특단의 조치들을 강구하고 있는지 좀 답변 주시면 좋겠습니다.
So it is difficult to tell a single intervention out of the others that made the difference early on and allowed us to reach what we have received. It was the combination of very agile logistics and outreach and availability. It is easy to get vaccinated in the community. There are many vaccination clinics all around the country. There's a lot of outreach. We used call centers to call people to schedule vaccination appointments. We used the apps in order to have people schedule their appointments. We had a lot of campaigns on TV, on radio, on billboards, and we had a lot of work with community leaders, religious leaders, and specific localities to work in order to promote vaccination. That's the first question. The question of what do we do now? Now we have the next 45% of the population to vaccinate, but 30% of the population we cannot vaccinate because they are younger than 16. And we will not vaccinate kids until there's a clinical study that proves that the vaccine is safe and effective in this age group. So we don't need to vaccinate now 45% of the population. It's less than that. We only have to vaccinate the remaining elderly. And so the numbers are not so big, and we're making a lot of efforts to continue pushing so we can vaccinate as many of them as quickly as possible.
We managed to get these numbers so fast, mainly because of crowd acceptance. We used all the country leaders to get vaccines. We started, first vaccine was given to Prime Minister Netanyahu, broadcasted live with all the channels. And there was a huge effort of the health department, health ministry, to push forward the vaccines using what we have, the health public organizations that are touching each and one of the citizens. And this is how we managed to get to these amazing numbers.
지금 그 백신 접종의 목표로 잡고 계신 거는 언제 어느 정도 몇 퍼센트 정도 접종 완료하시는 거를 목표로 잡고 계신가요?
We are trying to get to the immediate target set by the Prime Minister was 90% of the population above the age of 50. And we are very close. I think within a matter of a few weeks, we will be there. We are already above 80%.
네, 다음으로 접종 세부 절차에 대한 이야기를 나눠보겠습니다. 서울시의 1000만 시민 백신 접종 대장정을 총괄하시는 시민건강국장님이 제일 궁금해하실 듯한데요. 질문 있으십니까?
네, 안녕하세요. 이스라엘에서 이제 백신 접종 프로그램이 잘 진행이 돼서 사회적 거리 두기를 조금씩 이제 완화한다는 얘기가 굉장히 인상적입니다. 그래서 백신 접종 접근성을 높이기 위해서 의료기관이 아닌 전용 접종 센터를 운영해서 전 세계적으로 모범이 된다고 지금 이제 평가를 받고 있는데요. 지금 이스라엘에서 운영을 하고 있는 백신 이제 접종 전용 센터가 어느 정도 규모로 어떻게 운영되고 있는지 좀 알고 싶습니다.
So the vaccination clinics are operated by the HMOs mainly. And some of them are operated by it's called a Red Shield of David, or it's like the local version of the Red Cross. But most of the vaccination clinics are run by the HMOs, by the sick funds, by the big healthcare providers. And we as healthcare providers, we opened those vaccination clinics, hundreds of them, in a small country. So we have, as Lalit, hundreds of such vaccination clinics. The vaccination clinics get the vaccines from the big distribution centers of the government. And when they get it, they put it in the local freezers. And there's every such vaccination clinic has an interest with an administrator position that the person comes in, the swipe your card, and because all of the healthcare is digital in Israel, we know everything about the person. We know all of the allergies, we know all of the background conditions, we know if he has an appointment or not, and we can immediately put them in one of the tens of booths that you have in this vaccination clinic, where a nurse usually is standing and is vaccinating the person and putting it on the computer to note that he got vaccinated. And automatically he gets an appointment for the next dose 3 weeks later. And then he goes out in the vaccination clinic. There's chairs where they're sitting for 15 minutes to see that there's no acute reaction. And after that, they leave. And that's by and large the plan.
네, 감사합니다. 지금 이제 그 백신 전용 이제 접종 전용 센터 운영을 하면서 지금 밖에서 한 30분 정도 기다린다고 하셨는데 운영을 하시면서 이 부분에 대한 어떤 이제 어려움이나 이런 거는 없었는지요?
No, actually the whole process is very well streamlined. In many of these vaccination clinics, because they happen in big halls, we allocated a part of the hall for chairs. And you know, there's just a streamlined process where after every time they go, they sit there, they have a cooler with water, they can drink some water, they can get something to drink. And after 15 minutes, they're out. And we had no issues with that. We until now experienced no problem with this approach.
네, 감사합니다. 질문 하나만 더 드리도록 하겠습니다. 지금 이스라엘에서 하고 있는 드라이브 스루 백신 접종을 할 때 이제 속도를 높이는 장점은 있지만 실질적으로 안내하는 것이 힘들다는 단점이 있는 것 같습니다. 혹시 이제 실제 백신 관련돼서 이 드라이브 스루를 운영을 하시면서 어떤 부분 자체가 좀 이제 잘 운영이 되는 데 있어서 이제 좀 더 신경을 써야 되는지 이런 부분에 대한 의견 부탁드립니다.
So vast majority of the vaccination was not given in drive-thrus. It was given in traditional vaccination clinic. The patient comes in, he walks into the hall, he gets the vaccine in a booth, and then he sits on a chair. So, you know, the vast majority, this is how it was provided. So I don't think we have enough data to tell you strong inferences from the drive-thrus.
네, 감사합니다.
예, 저는 사전 예약 시스템에 대해서 궁금한데요. 사전 예약 시스템은 어떻게 운영되고 있는지, 만약에 예약한 시민이 안 나타나면 그분들한테는 어떤 페널티가 있는지, 그리고 아까 폐기하는 백신이 없다고 하셨는데 그러면 남을 경우 만약에 그 예약하신 분이 안 나타났을 경우 누구 다른 이제 시민을 대상으로 백신을 접종해야 되는데 그럴 경우 급하게 어떻게 대상자를 찾고 계시는지 그 점이 궁금합니다.
So the person who does not show up and leaves an opening in the queue is usually compensated by people who come uninvited. So in the Israeli culture, it is very accustomed for people not to necessarily follow the rules. And so some people come invited and some people come uninvited. And there's always enough people in the line to fill up for those who choose not to come in. If for some reason during the day we see that many people did not come in and there's a surplus of vaccines, the vaccination clinics takes out messages on media, on social media, on SMSs. Anybody in the area who wants to get vaccinated, there's an opening, come today, get vaccinated. And they come, they just flock in and they stand in line and they get all of the vaccines until the vials are done. And this is the operational agility I was talking about. Sometimes, you know, there's even stories about nurses going out of the clinic in the street and saying, you, come here, get vaccinated. I don't care if you're indicated or not, just go into the clinic. And so even that is happening to make sure that no dose is wasted.
예, 다음에 아까 차관님께서 그 그린 패스에 대해서 말씀을 하셨었잖아요. 근데 그러면 그 그린 패스는 2번 접종을 하고 나면 그 자리에서 바로 그 발급되는 건지, 그리고 또 그거하고 약간 또 다른 문제긴 한데 이 2번 접종 받은 사람도 마스크는 계속 그대로 쓰고 있는 건지, 2가지 질문이 되겠습니다. 그게 궁금합니다.
So the green passport is given to people who got 2 doses and 1 week has elapsed from the second dose. Only then you get the green passport. Now, after the green passport, you still have to put masks like everyone. You still have to maintain social distancing like everyone. But if you are exposed inadvertently to a person who's infected, you do not have to go into isolation and quarantine. And also, there are specific settings that are now open only to people with green badges. So if there is like a music concert or shows, only for people that can show a green badge. You don't show a green badge, you don't come into the closed set. So this is what is now happening in terms of the use of the green badge. I hope this is helpful.
Under what we call a green pass. And the green pass is only for those who had 1 week after the second dose, or to those who have been sick and recovered. So these people are getting a green pass, they get it on their app, they get it on the paper, whoever they want. But the paper, since we don't want it to be duplicated and forged, we have a barcode that is scanned, and the scan goes to our data, and then it proves that the person is truly part of the green pass. And with the green pass, we actually went through 2 stages, coming to the next stage on Sunday. The stages right now, what we have opened is we are dealing with shows. Shows are open. At least we're still limiting the numbers. So if you go to a show, a couple, you're sitting together. If a capsula can sit together and there's a 1 seat difference between the other people, all those who are entering the show are being, of course, checked and see that they are approved and that they are part of the Green Pass. But basically, this has opened the shows. It also opened the lectures.
네, 다음은 가장 많은 분들이 궁금해하시는 부분일 텐데요. 백신의 효과에 대한 이야기를 나눠보겠습니다.
예, 지금 이제 서울 시민들은 지난주에 이제 접종을 시작하고 좀 며칠 되지 않았고요. 지금 백신의 효과에 대해서 많은 이제 질문들을 하고 있습니다. 그래서 그동안 이스라엘의 경험에 따르면은 지금 이제 2회에 걸친 백신 접종을 완료하면은 그 백신의 효과가 지금 얼마나 계속될 것으로 기대하고 계신지 알고 싶습니다.
The answer for that cannot be provided at this time. We will need to follow up for more months, and we do have an ongoing surveillance system that continuously collects the data and analyzes it. And like the manuscript that we have published in the New England Journal of Medicine, we will continue to publish again and again follow-up of longer and longer time periods to be able to answer this question.
So that's one part, and I would like more to focus on my side on the future. Even though we're still facing high numbers of the disease, around the average of 3,500 daily, which is a lot, we need to reduce it. We decided to open the economy.
얼마 전에 이제 이스라엘 총리께서 3월 말까지 이제 성인들 16세 이상 모든 성인 대상 접종을 완료하고 4월에는 이제 일상으로 복귀를 희망한다고 그런 발표를 하셨다고 하는데 집단 면역 형성이라는 차원에서 봤을 때 이제 접종이 끝나고 언제쯤 이스라엘에서 집단 면역이 형성될 것으로 예측하고 계시나요?
Herd immunity is a unique point in time when enough people in the population has become immune to allow the fact that even without any special measures, the basic reproductive number or the effective reproductive number is below 1. So for this, in a disease like COVID-19, we will probably need to vaccinate over 80% of the population. In order to vaccinate over 80% of the population, we will have to vaccinate kids, and we will not be able to vaccinate kids until the trials for kids are done. And so I do not think we will reach herd immunity in the coming months. However, we will have indirect protective effects, which means not to the level of herd immunity, but to a level where the vast vaccination is allowing some epidemiological barriers, some protective effects from the vaccinated to the unvaccinated. And this partial protective effect, which is not herd immunity, but it is indirect protective effect, will reduce dissemination and will help us to mitigate further disease control. Whether this will be enough in April to prevent another wave of infection among the unvaccinated, I do not know. At the end of the day, almost 45% of the population is not vaccinated yet, and some of the others are not fully protected yet. So the country is still vulnerable for another wave, although the detrimental effects will be mitigated by the vaccination that was done until now for the elderly.
So we are in the middle of election right now. In 3 weeks, we have elections in Israel. I was yesterday in elderly house where there's about 200, 300 people that has their rooms there, active elderly house. I'm not talking about hospitalized. And they had in their conference room, big room, about 100 people sitting in differences. And I came in and there was a political debate. We were 3-4 different parliament members. And that was like going back to life, we call it, getting back into life. Still, everybody with masks, everybody sitting separately. But again, you're starting to see people getting together under this regulation. And on Sunday, we're opening the restaurants. Hotels have been opened, but with no food services still. And on Sunday, they will open the food service. And we have opened the pools. So pools are opening also. And we are also starting to open public participate in sports events. Under about, I think we're talking about 50% of the capacity of the hall, and we're still limiting the numbers. We don't want to see too many people together. We're opening on Sunday also for events for weddings and which were closed until now, all these places. So this is a huge change that is going now through Israel. And that's, I think, the first country that is basically able to do it because of the stage we are in regarding the vaccination.
예, 아까 이제 우리 랜디 발리코 교수님 프레젠테이션에서 3차 팬데믹이 오고 조금 이제 줄어드는 추세를 보이는 걸로 보이는데요. 지금 그러니까 1일 확진자 수, 하루에 발생하는 확진자 수가 확실하게 이렇게 백신 이후에 줄어들고 있는 건지. 근데 사실은 백신 말고도 이제 우리 사회적 거리두기, 소셜 디스턴싱도 하고 있고 뭐 여러 가지 있으니까 이게 과연 줄어든다고 하더라도 이게 백신의 효과만으로 볼 수 있을 건지 하는데 답변 좀 부탁드리겠습니다.
The reduction of the third wave is not solely due to the vaccines. We had strict lockdown for several weeks, also in January. So that was the initial cause of decline in the cases. What we are seeing as the effect of the vaccination campaign until now is the further decline in the severe cases that is very evident, especially among the elderly above the age of 60, which are the main population that is the source of the severe cases. And we see a very strong decline in the new severe cases in that group. And we hope that this will continue going down and thus reduce the effect of the residual infection on the severity and on the hospitals. But for now, our effective reproductive number is 1. The number of daily infections is constant, around 3,500. And I do not see, it will take us time until the vaccines would be so prevalent that vaccines by themselves will be able to further reduce dissemination. There is also an open-ended question about the exact level of vaccine effectiveness against transmission, which is different from the effect of the vaccination against symptomatic illness and against severe illness. And that question is still open-ended when we have studies, including prospective studies, to answer that question separately.
A major issue is, of course, the airport and the borders, which we kind of locked down very strongly since we saw what's going on with the different mutations. And I'll finish by that, but since we have elections coming in and we have Israeli people abroad who wants to come in and vote, we are now in the process of this conflict, and we're probably going to increase incoming Israelis under strict rules of isolation in home to come in and vote. So that's basically the issues we're dealing with right now.
이제 저기 변이 바이러스에 대한 질문 하나 드리겠습니다. 이제 지금 뭐 영국 변이 바이러스도 나오고 해서 변이 바이러스에 대한 지금 또 두려움 이렇게 또 생겼는데 이스라엘에는 지금 어떤 종류의 변이 바이러스들이 발생하고 있는지 하는 것과 지금 하고 있는 백신이 이런 변이 바이러스에는 또 효과가 있는 것인지 어떻게 생각하시는지 답변 좀 부탁드리겠습니다.
In Israel, the dominant strain to date is the UK Kent B117 variant. It is the cause of over 90% of infections in Israel today and has been so for a few weeks now. The assessment of the effectiveness of the vaccines that we have shown in the New England Journal of Medicine publication was in a time where most of the infections were caused by this British B117 variant. So with a high level of certainty, we can say that the Pfizer-BioNTech vaccine is probably effective, very effective, against the British variant. The South African variant is much, much less prevalent in Israel, only 1% now, and we still don't have any information to say anything scientifically sound about vaccine effectiveness against this South African variant or any other variant for now.
네, 다음은 백신 부작용에 대한 얘기를 나눠보도록 하겠습니다. 이재갑 교수님께서 이 부분 가장 궁금해하셨는데요. 교수님, 네, 질문해 주십시오.
예, 지금 한국에서 이제 백신 접종 시작한 지가 이제 5일 정도 됐거든요. 이제 그러다 보니까 이제 백신 접종 이후에 이상 반응, 어드버스 이벤트에 대한 그런 관심들이 국민 사이에 상당히 많습니다. 그래서 이스라엘에서 이번 접종을 하면서 그런 그 백신 접종 후에 어드버스 이벤트의 그런 접종자 수 대비 어느 정도 발생을 하고 있는지, 특히 중증 이상 반응은 어느 정도 발생했는지 이제 많이 궁금해하고 있거든요. 예.
So the side effects are being collected and monitored by the Israeli Ministry of Health. And they have not until now released any inference that shows of any unexpected severe adverse event that was not expected in the clinical trials. But I know that studies that are looking into the specific aspects of vaccine safety are still ongoing, and we should probably wait until there's enough data there in order to add more data beyond what's available in the clinical trials and in the reports of the Ministry of Health.
그 접종을 이제 하는 중간에 이런 이제 그 어드버스 이벤트, 그러니까 예상되지 않은 그런 부작용인데 사실 인과관계가 증명하기 어려운 상황이 발생할 수도 있는데요. 이제 그런 상황이 발생을 하게 되면 이제 많은 국민들이 불안해할 수도 있는데 이런 이제 접종을 시행하고 있는 그런 담당자로서 그런 국민들의 불안감이나 이런 부분들을 어떻게 좀 이겨내고 있는지, 어떤 사례들을 잘 어떤 방식으로 조절하고 있는지 이제 이런 부분들이 좀 궁금하거든요.
What we have used quite effectively is a system of full transparency. We say things as they are. When we know, we say we know. When we don't know, we say we don't know. And there's missing data, and the follow-up is still not very long. And there are things we don't know. And we must acknowledge what we don't know and tell it to the public as is to gain their trust. However, we can communicate to them and tell them, while maybe we don't know for sure, in 100%, everything that will happen 6 months, 12 months after the vaccine, we know for sure what happens 6 months, 12 months after the disease, after COVID-19. And we know the problems that the disease is causing. And so when you need to weigh unknowns and potential and theories versus very clear facts, then every person makes their own choice. And I think that the right choice is to get vaccinated.
예, 마지막으로 이제 질문하겠는데요. 이제 백신 거부하시는 분들이 좀 이제 유대교 신자분들 중에 좀 있다고 얘기를 들었습니다. 정통 유대교 신자 중에서. 그래서 그런 분들이 사실 접종을 이제 왜 안 맞으려고 하는지에 대한 이유 좀 알고 싶고요. 두 번째는 아까 이제 그 발제하실 때 그런 분들에 대한 설득 작업들을 이제 하신다고 얘기를 하셨거든요. 그러면 이렇게 설득 작업을 하면 어느 정도 분들이 이제 백신 거부를 했던 분들이 백신 실제 접종하게 됐는지 그런 그 조사된 내용이 있는지 좀 궁금합니다.
So from what we have seen, once you work with the community leaders and you provide culturally adapted information, there is an increase in acceptance and uptake in the various subgroups. So these efforts of education and open communication are helpful. So we did see after we had a lot of investment of time and efforts in the ultra-Orthodox community, there was a very large increase in uptake of vaccinations in this group. And same goes for people speaking Arabic, etc. So we think that these are very effective. As for the reasons why people don't get vaccinated, you know, there's two basically groups. There's the strong, hardcore conspiracy theorists and ideological opposers, but they are very small group. And there's a penumbra of people who are hesitant. And if you provide them with the right data, they will be likely to take the right decision. And that's where we're aiming.
네, 감사합니다.
다음으로 백신의 유통과 운반 시스템에 대한 이야기를 나눠보겠습니다. 네, 궁금하신 분 질의해 주십시오.
네, 지금 시간 관계상 그 여러 질문을 좀 드리고 싶습니다만 한 가지로 좀 압축해서 좀 질문을 드려보겠습니다. 이스라엘이 굉장히 그 백신 접종을 빠르고 또 많은 사람들에게 보급하고 접종하는데 그런 모습을 보여줬는데요. 이스라엘의 보건의료 체계에 어떤 특징이 이런 점에 기여했다 이렇게 말할 수 있는 부분이 있는지, 그리고 또 그것이 다른 나라에게 어떤 교훈과 시사점을 줄 수 있는지 그 부분을 설명해 주시면 감사하겠습니다.
I think that it's difficult to make adequate comparisons of healthcare systems in such a short amount of time. Every system is perfectly built to serve the unique setting of the people, the financial structure, the cultural structure, and the values of that society. In Israel, we have universal healthcare, and we have this universal healthcare provided by 4 big organizations, and for us, that proves very useful because these are very strong logistical organizations. They have an ongoing, intimate connection with the patient on an ongoing basis outside the hospital setting, in the community setting, with the general practitioners having a lot of daily communication with them. And this system has been proven to be invaluable for us in this COVID-19 event, for caring for the patients as well as for providing the vaccination. But the ideal really differs by setting, by size of the country, and by the set of values that guide the country. And so it is very difficult to make comparison.
네, 마지막으로 백신 접종에 대한 신뢰도를 높이기 위한 노력에 대해 이야기 나눠보겠습니다. 네, 혹시 질문하실 분 있으십니까?
예, 제가 마지막 질문이 되겠네요. 백신의 신뢰도 관련해서 질문 하나 드리겠습니다. 이제 그 이스라엘에서도 마찬가지지만 모든 분들이 백신에 대해서 신뢰를 하는 건 아닐 테고요. 또 이런 불안해하는 분들도 많을 텐데, 아까 프레젠테이션에서 조금 말씀 주셨습니다만은 이런 불안해하는 시민들 또 국민들을 위해서 어떤 노력을 하셨는지 좀 답변 주시고요. 이어서 그 요즘 가짜 뉴스, 페이크 뉴스가 세계적으로 많은 것 같습니다. 그래서 이스라엘도 이런 가짜 뉴스들이 어떤 양태로 나타나는지 또 그에 대해서 어떻게 조치를 하고 계신지, 이렇게 2가지 질문 드리겠습니다.
So fake news is indeed always a great challenge in every country and in every system, and Israel is no different. We try to be available to the media, social media, and regular media to identify first hints of such fake news and to contradict them with accurate, scientific information coming from figures that the public trusts. People who are experts, people who have been careful to provide accurate information throughout the event. And so when people have to choose who to believe, they would likely choose the people whom they know and trust and that have not failed them. So this is a key thing, to build trust, to maintain trust, to provide accurate information, to be transparent, and when you're not sure, to say, I'm not sure. The public very much appreciates the fact that we don't know everything and that we are open and candid about what we don't.
네, 오늘 이렇게 백신 접종과 관련해서 다양한 이야기를 나눠봤습니다. 지금까지 많은 말씀을 하셨지만 마지막으로 백신 접종과 관련해서 또 발리커 교수님께서 마무리 말씀 부탁드리겠습니다.
So I just want to thank you for the time you have taken to for mutual learnings today. We have much to learn from the health system as well as from the plan that you have put forward and have kindly presented today. I was happy to see and take ideas from that. And I'm glad that we could have shared some of our ideas and experience, and hope it will be useful and that will help both strengthen your plans for the future as well as the bilateral collaboration and future work between our country and healthcare organizations and your entire healthcare and municipal system. Thank you very much for your time.
주한 이스라엘 대사님께도 한 말씀 부탁드립니다.
I just wanted to say, first of all, I wanted to thank very much our friends in the Seoul municipality, Acting Mayor Jung Hyuk-seo. Thanks very much for this. I wanted to say something as an Israeli living here. Your city is remarkable. The resilience of Seoul, the way that you are handling this pandemic, we have a tremendous amount to learn from you as well. My recommendation, please, in 3 months' time, when we are able to move around about, I think that we should sit together, try to do something face-to-face between Israeli experts, your metropolitan experts, to debrief about how we handled COVID and how we can handle future catastrophes that should never happen to us. But I must say, as an Israeli living here, the way that you are handling the pandemic is remarkable, and we have a tremendous amount to learn from you as well. So thank you very, very much. 감사합니다.
네, 마지막으로 서울시를 대표해서 서정엽 권한대행님의 말무리 말씀 부탁드립니다.
Yeah, thank you. And there is a Korean saying that goes, experience is the best teacher. So all of the advice that Deputy Minister Kishi and Dr. Balikar gave us today was based on actual experience. So all of the advice that you gave us today is indeed priceless. Especially, I'd like to express my special thanks to Dr. Randy Balikar. You had a really hard time today answering all kinds of questions from us. Everyone at the Seoul Metropolitan Government, myself included, is very grateful for your advice today. We will reflect your advice in our policies regarding vaccination so that the entire process goes systematically and safely. I hope that today's occasion is not just a one-time only event, and I hope that it leads to more opportunities for sharing and discussions in the future. Thank you very much again. Thank you.
네, 온라인 컨퍼런스를 마치겠습니다. 모두 감사합니다.